Okay, so that's a hard act to follow, but thank you very much, and I'm very proud to be up here on behalf of our team to tell you our story. So, as you heard from the health minister, cancer is a word that no one really wants to hear. It's a word that brings with it anxiety, uncertainty, and often fear. Heart disease also causes a significant amount of morbidity in our population, and in fact, cancer and heart disease are the number 1 and 2 causes of mortality in the Canadian population. But there is reason for optimism. We hear almost every week, we hear about cancer discoveries, and we know that some of these cancer discoveries will lead to new cancer treatment options for our patients. And the same can be said for heart disease. But with these treatment options come the risk of side effects. And those side effects can be acute and short-lived, such as nausea and vomiting that we see with some of the chemotherapies that we deliver, or they can occur years later and can be long-lasting and significant, such as congestive heart failure, secondary cancers. So in May of 2005, I was fortunate enough to attend the American Society of Clinical Oncology meeting in San Francisco, and the results of 2 studies looking at women with early-stage breast cancer that overexpressed a protein called HER2 were presented at that meeting. And the results of these studies were practice-changing. What they showed is that there was a 50% reduction in the risk of breast cancer recurrences for women who received chemotherapy and a drug called trastuzumab, or Herceptin, which was an antibody. So this was quickly adopted by oncologists from around the world, and they started using this in their respective centers. But within 1 or 2 years' time, we started to talk to each other, and we started to notice that some of these women were experiencing more cardiac dysfunction than had been reported in the clinical trial. And when I mean cardiac dysfunction, it was manifested by a drop in their ejection fraction, which is the ability of the heart to squeeze. So we were noticing more of this than had been noticed in the clinical trial, and this shouldn't be entirely surprising because patients in clinical trials are a highly selected group of patients versus the general public, who are a different population. So that put the oncologists in a bit of a dilemma. We wanted to provide the best treatment for our patients and the best chance of cure, but we didn't want to give them long-term cardiac toxicity. So the cured cancer patient of today certainly does not want to become the heart failure patient of tomorrow. So it was really with this background in mind that we sat down with our cardiology colleagues and got together and said, we need to do something about this. We need to get together and we need to try and figure out a way that we can give patients the best possible cancer treatment while maintaining cardiac health. So in October of 2008, we established our Cardiac Oncology Clinic, which was the first such clinic in Canada. Our goal was to provide all cancer patients who were experiencing cardiotoxicity from their cancer treatment rapid access to a cardiologist. And not just any cardiologist. We wanted them to see a cardiologist who understood what a cancer drug was, what it meant, what it did, and also understood the importance to that cancer patient of receiving that drug. Because up to then, the common answer would be, well, your drug is causing problems, so just stop it and everything will be okay. But it wasn't okay. Our patients needed those drugs, and so we wanted to ensure that they were on board with us and helping us ensure that our patients could get treated. We also felt that education was important, so we wanted to try and see if we could help educate other healthcare professionals as well as patients in terms of the consequences of cancer therapies on the heart. And of course, if we wanted to learn more and advance this field, research was also very important. So over the past 5 years, we've had approximately 500 patients come through our clinic with a variety of tumor types, the most common being breast cancer. And the good news is that even though some of these patients presented with mild to moderate heart dysfunction, the majority of those patients were able to complete their prescribed cancer therapy. So now I'd like to show you just a short video of the experience of one of our patients in our cardiac oncology clinic.
At one point through my treatment, the heart rate or the performance of the heart did go down fairly low, and the team continued to, or the cardiologist continued to monitor that to make sure that I could continue the Herceptin. That was very, very important to me. that I was being monitored. I thought to myself that I had to battle, the breast cancer. I had to go through and battle that, and possibly have to deal down the road with heart issues. December 18th is the end of my treatment. I have returned to work, and I remember at one point saying to Dr. Dent, where am I? And she basically said, "You're all good, Lisa. You're good."
So we were very happy with our program in Ottawa, but we also felt that cancer patients across Canada should also have access to a dedicated cardiac oncology program so that patients could benefit from such a process. And so we set up a preceptorship program in our center. We hold it twice a year, and the goal of that preceptorship program is to bring oncologists and cardiologists and nurse practitioners from across the country to our center to help them set up their own clinics, dedicated clinics in their respective cities, and there are clinics now opening up across Canada. We also established the Cardiac Oncology Fellowship Program. It's the first of its kind in North America, and Dr. Jeffrey Sulfer is with us here tonight. He started it in July of this year, and the purpose of this fellowship program is to promote education and research. And finally, in order to increase collaboration, not only across Ontario, but across the country and internationally, in 2011, we established the Canadian Cardiac Oncology Network. To date, we've had 3 international meetings. We've had people from around the world attending, and we're holding another meeting next May of this year in Ottawa. And finally, in terms of education and advancing our cause and research, et cetera, we've established a website, and I'm happy to announce that this website was launched last week. You're free to go visit at any point, www.cardiaconcology.ca, and this website will hopefully foster more collaboration, research, not only in Ontario, Canada, but across the world. So on behalf of my team, I want to thank them very much for their 5 years of hard work, and to thank the committee for choosing us for this Innovation Award. Thank you.